Hi everyone, thank you for attending this presentation on physiotherapy waitlists in a community-based child development centre. I'm Fiona Lesota, I'm a physiotherapist at the BC Centre for Ability.
And I'm April Leung, physiotherapist at BC Centre for Ability.
Our context. The BC Centre for Ability is a non-profit organisation providing community-based rehabilitation, psychosocial and child development services to children, youth and their families. The Early Intervention Programme provides services to children aged birth to school entry who present with a developmental delay and live in our catchment area. Our interdisciplinary team includes physiotherapists, speech-language pathologists, occupational therapists and social workers. The problem. In the summer of 2020, there were over 150 children waiting for our physiotherapy service. The longest wait time for non-urgent children was over 2 years. Average wait time was over 10 months, and the wait lists were not consistent across regions. Vancouver and Richmond, a longer wait list than Burnaby and North Shore. Complaints were received from therapists, community partners, and families about wait times. The opportunity. COVID-19 pandemic forced us to change our service delivery model. Leadership changes resulted in new people bringing fresh eyes and a new way of looking at things. Our new team leader for physio noticed that all children were waiting for the same service, even if their needs were really minor. The pandemic resulted in so many changes for staff and our families that we were forced to try things differently and work and live in different ways than we had ever done before. This resulted in service delivery changes. We had to find a way to completely change how we delivered services, move to online platforms, and change many of our paper-based processes. None of us had ever provided physiotherapy services to children over the internet before, but we were forced to give it a go. Service delivery models. Change in options for service delivery due to the pandemic created an opportunity. Parents had less expectation of home visits with the pandemic. So pre-pandemic, we had in-person visits in a variety of locations, coaching model, and therapists were assigned to a region to reduce travel. During the pandemic, virtual and in-person visits, we had visits primarily outdoors or in clinic, coaching model, and travel dramatically reduced because we were working from home or we were having the clinic at the centre. The Gross Motor Clinic. Here we introduced a new service model for children with uncomplicated physiotherapy needs. So all clients benefited as clients needing more moved up the wait list. Combined regional wait lists, centralised scheduling and simplified reporting. Children enrolled could have their physiotherapy needs met using virtual or clinic-based visits. Children who required our traditional service model were not enrolled. Our traditional service model involves a more team-based approach for children with more complicated physiotherapy needs. If consultations are required in the home, preschool or daycare, then those would continue to be provided by the regional physiotherapist. Some children are seen as often as once per month in the gross motor clinic, but on average seen about every 3 months. Also, doing some joint visits with the occupational therapists and speech therapists with the family at the gross motor clinic was possible. Initial intervention. We introduced gross motor clinic as our initial intervention. Families were given an option of a virtual or in-person visit. 77 eligible clients were identified by a chart review and consultation with community partners who last saw the client. Information gleaned from community partners was primarily from infant development and the physiotherapy consultants to IDP. We offered an appointment to all of the 77 clients, but only 50 children got back to us and were screened by a physiotherapist to determine if Gross Motor Clinic was a good fit. 27 clients were discharged at an intake because they didn't need service or they did not call us back. 5 more clients were discharged after screening. 42% or 32 clients did not require service. 45% or 35 clients were enrolled in the clinic. 13% or 10 clients were not eligible for client and were returned to the waitlist for regular service. Eligible families were also asked to complete a patient-reported outcome measure, the PDCAT, and a client experience survey.
All right, and I'll take over from here. So this graph shows the number of children waiting before we started the Gross Motor Clinic, and that's shown in navy color. And 1 month after the Gross Motor Clinic has started, which is in yellow. Overall, there has been a 49% decrease in the physiotherapy waitlist since we started the clinic. And after the first quarter of 2021, we did our analysis again and noticed the wait list for physiotherapy services has decreased by 76% since the Gross Motor Clinic has started. The average wait time has decreased by 8 months. So this is a summary of the number of children across all the regions from August to March. In navy color, you'll notice the number of referrals. Yellow is the number of people on the wait list, and blue is the number of people on in the Gross Motor Clinic. And so we started the Gross Motor Clinic in September. Since then, the wait list has been decreased and has been quite consistent. In fact, there has been an increase in the number of referrals in January, but the wait list level is still about the same. So there is a sustained impact on the wait list after the Gross Motor Clinic has started. And because we cleared up a big portion of the wait list, we can also see the clients with more complicated needs sooner. So the clients that are waiting for regular physiotherapy services. We had some positive feedback from families. So this is one of the quotes. Anything that can be done to shorten the wait time is great. We know early intervention is so important. It's been so wonderful to have a therapist give us tips and tricks about how to get him to the next step. We've continued to see improvements during the pandemic that we really didn't expect. We heard that the wait time for service was really long at the BC Centre for Ability, especially for physiotherapy in Vancouver. We were so surprised and thrilled when we were able to see a therapist almost right away, and then the plan she gave us was followed through right away by another therapist in the Gross Motor Clinic. We knew what to expect and what the next steps would be, and then they all just happened according to the plan. So lessons learned. We had positive results in the patient-reported measures, but the completion rate was low. We need to find other measures to check our patient satisfaction, and we'll continue to interview families. We know that education about the service delivery model and its purpose is required at every touch point. Basically, the Gross Motor Clinic was rolled out really quickly because we had such a long wait list. But now, looking back, we want to make sure that every team member knows about the Gross Motor Clinic. For example, we want admin to know about the clinic so they can book clients in and explain this to the families. We want other staff and community partners to know about this clinic so they can refer clients to the clinic. We understand that clinics in the home communities are preferred. So oftentimes it's hard for families to travel outside of their region to see their therapists. So it's helpful to have the clinics within their region. And also a playground clinic could be beneficial. In fact, we just had a playground clinic last week and it went really well. We could practice some really functional gross motor skills in the playground where a therapist met multiple clients at the playground at different times. And that's possible when the weather is nice. Finally, we know that it requires a lot of administrative time. For next steps, we want to interview families to supplement the survey data. We want to look at the goal attainment and scores on the PDCAT to check the change scores, make sure that our clients are improving. We want to create and share educational resources about the Gross Motor Clinic. We want to find space for clinic in the communities. We want to streamline administrative processes. And finally, we have applied and secured funding from a family organization, and we can maintain this new service delivery model. Thank you very much for your time.